Hantavirus represents a group of viral pathogens that are primarily carried by wild rodents, including various species of mice and rats. While human infections remain relatively rare on a global scale, they can lead to extremely severe and life-threatening medical conditions. The virus is known to cause two major syndromes, the first being hantavirus pulmonary syndrome, which primarily affects the lungs. The second major condition is hemorrhagic fever with renal syndrome, a disease that specifically targets the kidneys and vascular system. Transmission to humans typically occurs through direct interaction with the biological waste of infected rodents, such as urine or saliva. A common route of exposure is the inhalation of microscopic particles found in dust that has been contaminated by rodent droppings. This dust can easily become airborne during cleaning or movement, creating a hidden risk in areas where rodents have nested. While the vast majority of cases stem from rodent to human contact, there are rare exceptions to this standard transmission pattern. Specifically, the Andes virus strain has been documented to spread between humans in very limited and isolated circumstances. As of May 2026, health authorities are closely monitoring a notable outbreak linked to the cruise ship known as the MV Hantavirus. This specific incident has resulted in 13 reported cases, with 11 of those being confirmed by laboratory testing. Tragically, this outbreak has already led to 3 deaths, highlighting the serious nature of the viral infection. The impact of this cruise ship cluster has been multinational, with cases identified in Canada, the Netherlands, and Spain. The World Health Organization has been notified of these developments and is coordinating with international health agencies. Despite the recent cluster, the World Health Organization currently assesses the overall global risk to the public as low. However, health officials remain on high alert because the virus possesses a remarkably long incubation period for patients. This incubation phase can last up to 6 weeks, meaning that an individual could be infected without showing immediate signs. Because of this extended window, experts warn that additional cases may still emerge as the monitoring period continues. Early clinical symptoms of hantavirus often mimic common illnesses, making the initial diagnosis a challenge for medical providers. Patients typically begin by experiencing a fever, often accompanied by persistent headaches and generalized muscle pain throughout the body. Other common early warning signs include feelings of nausea and bouts of vomiting, which can be easily mistaken for the flu. As the infection progresses into its more advanced stages, the clinical picture changes rapidly and becomes much more severe. The virus can cause the lungs to fill with fluid, leading to a condition known as severe pneumonia in the patient. This respiratory distress often requires immediate medical intervention to ensure the patient can continue to breathe effectively. In extreme cases, the body may enter a state of shock, which is a life-threatening complication of the systemic infection. For those suffering from hemorrhagic fever with renal syndrome, the virus specifically attacks the function of the kidneys. This can lead to significant renal impairment, requiring specialized medical attention to manage fluid levels and waste removal. Currently, there is no specific antiviral medication that has been approved to cure or directly treat a hantavirus infection. Because of this, the medical strategy relies entirely on providing high-quality supportive care to the affected patient. Early detection is absolutely vital, as it allows doctors to begin supportive measures before the disease reaches its peak. Patients are almost always managed within intensive care units to ensure they receive constant monitoring and professional support. Oxygen therapy is a cornerstone of this treatment, helping to stabilize respiratory function while the body fights the virus. Maintaining a careful fluid balance is also critical, especially for patients experiencing kidney-related complications from the infection. While some regions are currently testing experimental antivirals, these treatments are not yet considered a standard or proven cure. Because treatment options are limited, the most effective defense against hantavirus is proactive and consistent prevention. The primary goal of prevention is to minimize any potential contact between humans and rodent populations in the wild. This involves taking active steps to control rodent populations within your home and the immediate surrounding environment. Sealing entry points where mice or rats could potentially gain access to your living space is a highly effective strategy. When you are tasked with cleaning areas that may be contaminated by rodent droppings, you must take specific safety precautions. Always wear protective gloves to ensure that your skin does not come into direct contact with potentially infectious materials. Wearing a mask is also essential to prevent the accidental inhalation of dust particles that could contain the virus. Avoid sweeping or vacuuming dry areas where droppings are present, as this action can stir up dangerous, contaminated dust. Instead, use a wet cleaning method with disinfectant to safely neutralize and remove the waste without spreading particles. Proper food storage is another critical component of keeping your home safe and unattractive to scavenging rodents. Ensure that all food and water supplies are kept in sealed, rodent-proof containers at all times within your kitchen. By removing potential food sources, you drastically reduce the likelihood of rodents nesting near your living areas. If you live in or are traveling to an area with a reported outbreak, you must be extra vigilant about your surroundings. Avoid high-risk areas, such as abandoned buildings or woodpiles, where rodents are known to congregate in large numbers. Always follow the specific health guidelines provided by your local authorities to minimize your risk of exposure. Staying informed about local outbreaks can help you make better decisions about where to travel and how to stay safe. In summary, while hantavirus is a rare condition, it remains a potentially deadly threat that requires serious attention. The recent cruise ship outbreak serves as a stark reminder of how quickly multinational cases can emerge and spread. It highlights the importance of global surveillance and the need for rapid communication between international health organizations. Since there is no specific cure, our medical focus must remain on providing the best possible supportive care for patients. Prevention remains our strongest tool, and it is entirely within our control to reduce the risks in our daily lives. By focusing on rodent control and hygiene, we can effectively block the primary pathways through which this virus spreads. Understanding the symptoms and the transmission routes is the first step toward protecting yourself and your community. Stay cautious, keep your living spaces clean, and always prioritize safety when dealing with potential rodent habitats. The combination of public awareness and proactive environmental management is the best way to keep hantavirus at bay. By staying vigilant and informed, we can navigate these health challenges and keep our communities safe from infection.